Good day everyone, I am Angel Bertin T. Campus from BSN 1-2 of Isabela State University at Tiaga Main Campus. For today's video, you will be joining me in performing a return demonstration on the assessment of the ears of a patient. Primary to performing the procedure, be sure to first perform hand hygiene such as hand washing in order to avoid transferring harmful microorganisms to your client since we consider all fluids as contaminated. Second, prepare the materials needed for the examination. We only needed a pen light that is used for examining the external part of the ear of a patient and also a gloves for a protection to us and to the patient. Now, we can continue our assessment. So the first thing we must do is to introduce ourselves to the client, identify our client, and ask how he wants to be addressed. So good day, sir. I am Angel Bertin T. Campus, your student nurse for today. So, sir, I would like to ask your name and age to ensure that I am with the right patient. So what's your name? What's your name, sir?
John Mark D. Del Monte.
John Moore.
80 years old.
So, sir, kindly recheck your information. Okay, thank you, sir. By the way, sir, before we start, may I ask, how do you prefer me to call you?
Just call me Jay.
Okay, thank you, sir. Next is to explain the patient how and what is the importance and significance of the assessment that we are going to do. So, sir, I'll be explaining you the procedure that we'll be going to do today. So, I will be assessing your ears and hearing acuity. To be able to make those things, I will be performing a tag test inspection to your external ears and palpation or palpation, I should say, on the area surrounding your ear. So, as the other procedures, which will be instructed to you later. So, do you have any questions before I proceed to the assessment? Okay, so if you do have any question, you can interrupt and ask me throughout the assessment, sir. Okay. So, after that, then we will ask the client if the things that I will going to do to him is okay for him or her, and tell the client that all data and findings gathered will just be confidential to the both of us and the attending physician. So sir, I will do a physical examination on you, which includes exposing some part of your body and me touching some parts of your body. Would that be okay, sir? Okay. So rest assured, sir, that the result in this assessment is just between you and me and to the attending physician that I will be referring to you. Okay, sir? Okay. So now we will ask the client to wear a gown for easily access of the examination. And we need also to provide a privacy by closing the doors and the curtains. So, sir, would you mind if you change your clothes into the gown I will be giving to you? Okay, sir. Now, since the door is closed, we can now close the curtain. Okay. Before we start the examination, inquire if the client has any history on the hearing. Okay, so Sir JM, before I start, I will ask some questions about your family history regarding hearing acuity. So, sir, do you have any family history of hearing problems or loss? Okay. Any presence of ear problem or pain, sir?
No.
Okay. So, do you have any medication history regarding hearing acuity? None. Okay. So, does you feel any ringing in the ears? Yes. Okay, sir. How often, sir? Sometimes, just sometimes, or?
Sometimes.
Okay, sir. Okay. So, do you feel any hearing difficulty, sir?
No.
Okay. Thank you, sir. So, I don't see any problems regarding your history, sir, except the ringing in the eyes, sir. Okay, so I will just take note of that and tell it to your attending physician. So the patient will remain in sitting position all throughout the assessment. Our first part of the assessment is the external ear structure. So inspect the auricle, the tragus, and the lobule for size and shape, pose or lesion, or any discoloration and charges. So Sir JM, I will just put my gloves and inspect your auricle. Okay. So, I will also be inspecting your tragus and lobule. Okay, sir, I'm done. So, sir, I will be touching your ears and look for or inspect for those parts. Okay. So, as I can see, sir, your ears are symmetrical to your head. So, let me see, so I can see that your auricle is okay. There is no deformities and so as a scar or any strange what do you call it? You have no strange discharge. Okay. So okay. There is no any skin lesions or scars present on the both ear. The colors are also evenly distributed and there is no such discharge. Also, sir, your auricle have no deformities. So now let's check to the posterior part. Okay. Okay. So as I can see, there is neither a lesion nor a scar, which gives us a good sensor. Okay, so our next is the tag test. So I will be pulling your helix up and down and tell me if you feel pain while doing the examination. Okay, sir. So let's start with your right ear. Okay, so I will be pulling it. So, do you feel any pain, sir?
None.
Okay. Okay. Onto your left. Okay. Do you feel any pain, sir?
None.
Okay. Okay. So usually, sir, if you do feel any pain in that helix, it could be due to infection. But since you don't felt any pain, so there is no signs of infection in your external part of the ears, and that will be a good sign. So next is to palpitate the auricle and the mastoid process for tenderness. So sir, now I am going to palpate your auricle and mastoid to examine if there is tenderness or swelling. So, okay sir. So, first this one. Okay. So your mastoid. Okay. The other side, sir. Okay, to the mastoid. Okay. So, okay, sir, it looks like there is no tenderness on the part of that ear and so as swelling. Okay. So, the second part of the assessment is the otoscope examination. First is to inspect the external auditory canal with the otoscope for the discharge, color and consistency of the cerumen, color and consistency of the canal walls and nodules. So, since we do not have an otoscope, sir, I will be using a pen light to check your external auditory canal. We will see if there are any discharge from the area. And for the color and consistency of the cerumen, color and canal walls and the nodules. Sir, kindly picture. Okay, sir, thank you. A little bit, sir. Okay, sir. Okay, sir. Sir. Okay. So, for the ear canal, I can see the presence of the hairs. So, there is no discoloration and the color is evenly distributed, okay? There is also no strange for discharge coming out from the canal. And you can also see, sir, that the consistency of the serum, color, and as well as the canal wall. There is the presence of the serum, okay? Okay, thank you, sir. This means that they are all in good signs. Onto the other side, sir, please. Okay, sir. Okay, so there is also the presence of the hair. And I can see the presence of the serum. There is also no strange discharge. And you can see the colors are even. Okay. So both of your eyes are, or your ears are in good sign, sir. So now next will be to inspect the tympanic membrane using the otoscope for the color, shape, and the consistency and landmarks. So sir, we will be moving on the tympanic membrane for the same reason. Okay, sir, I will be using again my pen light to check your tympanic membrane. Okay, a little bit closer, sir, please. Okay, thank you, sir. As I can see, the tympanic membrane color ranges from pinkish to pinkish gray, sir. And there is no presence of laceration on the pars tersa, and also with the pars flaccida are intact. Okay. So for the handling malleus as well as the short process, they are oblique in position and situated behind the upper part of the eardrum. Okay, to the other, sir. Okay, so I can see the color of the tympanic membrane is a pinkish gray. There is also no laceration in the pars tensa and pars flaccida, which is a good sign. Okay. Also, the malleus and the short process, they are also in oblique position. Okay, which means these are all in good signs, sir. Okay, so now have the client perform the Valsavar maneuver and observe the center of the tympanic membrane for a flatter. Okay, sir. Remember to do not do this test to an older client because as it may interfere with equilibrium and cause dizziness. So, sir, kindly pinch your nose like this, sir. Okay, sir. Then close your mouth. Okay, sir. Now inhale for 15 to 20 seconds, sir. 1, 2, 3, go. Okay, sir. Now inhale. Okay. So, did you feel any rapid vibration to your ears, sir? Okay, thank you, sir. So, for the last part of the examination, we will be performing a total hearing of the equilibrium test. So, first is to perform a whisper test by having the client place a finger on the tragus of one ear. So, whisper two-syllable word, 1 to 2 feet behind the client. Repeat on the other ear. So, with the whisper test, sir, I will stand for about 2 feet on both your ears and behind you and say a word. So, you must repeat the word I have told you. Okay, sir?
Okay.
Okay, are you ready, sir?
Yeah.
Okay, sir. So, onto your right, sir.
Ang ganda mo.
Okay, thank you, sir.
Kanino ka?
Okay.
Asan ka?
Okay, that's good, sir. Okay, sir. So 2 of my words are correct. The first one, ang ganda mo. The second one, I said kalbo ka, and you said kanino. Kanino ka? Is that correct, sir? Yes, you said. So, and the last one, I said, what did I say, sir? I forgot. Asan ako? Yes, sir. Asan. Okay, so 2 out of 3. Sir, you did correct. Okay. So it is a good sign, sir, but I will still be going to take note of it to inform the physician. Okay. Now, after that, sir, we will be performing the Weber test by using a tuning fork placed on the center ear of the head or forehead, and ask whether the client hears the sound better in one ear or at the same in both ears. So, since we do not have a tuning port, sir, I will be using a phone and let it vibrate. Okay, sir. So, I will put it in your forehead and let you hear the sound. Okay, sir? Okay, sir. Now, 1, 2, 3, go. Okay, sir. Sir, did you hear the vibration with both of your ears?
Yeah.
Is the other ear louder or not?
No.
Okay, they are just perfectly fine, and they can hear it. So I'll be taking down notes on that. Okay. So now after that, we will be performing the rank test by using a tuning fork again and placing the bass on the client's mastoid process. When the client is no longer hears the sound, note the time interval and move it in front of the external ear. And when the client can no longer hear the sound, note for the interval. Okay, sir. So I will be doing the same procedure, but I will be putting the vibration in your mastoid, or I should say masteroid. Okay, sir. Then if you sir, excuse me. I will repeat my instructions, sir. So we will doing the same procedure, but with a different location. So I'll be placing this phone to your mastoid process. And when you will when you will not hear anything, say stop, so I can place it quickly to your external ear. And if you cannot hear anything again, you can say stop. Okay, sir? Okay. So we will be performing now, sir.
Stop.
Okay, sir.
Stop.
Okay, sir. Sir, so it looks like your time interval are more than a minute. Okay, so I will take note of that. Okay, so into the other ear, sir. Okay.
Stop. Stop.
Okay, sir. Thank you. So it looks like onto your what's that, right ear, left ear. It's almost the same with your right ear and left ear. Okay. Okay, sir. So lastly, we will be performing the Romberg test to evaluate the equilibrium. So sir, with feet together and arms at the side. So you will close your eyes for 20 seconds and I will be observing for the swinging. So Sir JM, please kindly stand. Okay, sir. We'll be moving this. Thank you, sir. So please close your feet together like this, sir. Okay, and your arms at the side. Okay. So now, sir, close your eyes and it will be for 20 seconds, and then when I say that you open your eyes, that will only be the time that you can open your eyes. Okay, sir? Okay, sir. So please close your eyes, sir. Okay. So we will be observing the swaying. Again, sir, open your eyes. Don't open your eyes, sir, when I say that you will not open it yet. Okay, sir? Okay, 1, 2, 3, go. So we will be observing the swaying of the body of our client for about 20 seconds. Okay. Okay. Okay, sir, you can open your eyes. Okay, that's good to hear, sir, because I didn't observe any swaying of your body and you stand still. So that's a good sign, sir. to know, sir. So you can sit down now, sir. Okay, sir. So you are not being imbalanced even slightly. You can balance yourself even though your eyes are closed, which means that it is a good sign. You can control your body and you will maintain your posture all the way for the 20 seconds. Okay, sir. So I'll be taking note of that. So now we are all done in our assessment, sir. Thank you so much for your cooperation. I will make sure that all notes I have will be given to the attending physician for further review, sir. For all in all, sir, your hearing acuity is good. And as I can see and as I can observe within the records that I have gathered, I can see that there is no such thing as abnormalities or dysfunction of your hearing. But I will make sure to give it to the physician for further reviews. And we will just call you later if there is something that is not good or dysfunctioning in your hearing, sir. Okay, thank you, sir, and God bless.